All right, y'all. So good morning from the West Coast, but I'm over on the East Coast right now. So good afternoon. But if you're calling from another part, good evening. My name is Kat Cruz. I am currently a student at Johns Hopkins, but I'm also a policy associate for this organization called Research to Policy Collaboration. And I basically work at the intersection of policy and public health. So I just wanted to show y'all my path into politics. I thought I was going to be a doctor. I thought I was going to be a sports doctor, a pediatrician, and then life obviously just had different plans for me. And so I did the whole basic like biology pre-med track. But I graduated college when Trump got elected, and that was not okay with me. And so I was also having a bit of an existential crisis and trying to figure out what it is that I wanted in life. And so I took a chance and was like, let me see what I can do. I really liked the March for Science rally. And so I sort of fell into politics. I moved back home and worked on a congressional campaign and helped flip it from red to blue. And so I was part of that big blue wave in 2018. And just fell in from there. And then my next job was at the American Heart Association, where I also worked on advocacy and research in that intersection as well. And then from there, I got into Hopkins somehow. And then I also got this job as a policy associate. And so I just wanted to show y'all that my pathway wasn't linear. I thought I wanted something and I sort of fell into something else. And I also put that beaker right there because that is a dissected heart and I didn't want to like gross anybody out super early in the morning. So just know that I really was a biology major and I did the whole dissection, but I didn't want to gross people out. And then that picture down below is actually a picture of my very first lobby day. I actually got to lead a lobby day at the Texas Capitol for the American Heart Association. So I was really proud of that. Got to go around and talk to different representatives and senators. And so just very proud of that. And so I also want to go over today's agenda and the big three things that I'm going to be talking to y'all about. So one thing that I definitely want to talk to y'all about is the relationship between science and policy. And I think everyone sort of has this idea of what it looks like in DC or even at the state level. And I promise you it's not what you think at all. The next thing I also wanted to talk about is how to communicate to policymakers. That's a big part of my job. I teach researchers how to talk to policymakers. And I can guarantee you that y'all would probably do a much better job than the researchers that I work with. And I just wanted to show y'all like the tips and basically how to get that going. And then the last thing that I wanted to talk about is how to better integrate science and policy and get involved. And I know everyone here is my age, so you know how to get involved. But I also want to show you different ways using your background as a public health professional and really using the knowledge that you have to better inform policymakers. Okay. So what is the relationship between science and policy? It is very complicated. Basically, it's two sides at an impasse that don't know how to communicate to each other, but they both need each other. And so, as y'all know, there are always articles behind a paywall. Like we always have to go to JSTOR and see what we can find because it's just behind a paywall. So if you think you're having a hard time, it's even more so for research, for policymakers. They use this thing called the Congressional Research Service. So there's a bunch of researchers who help, I guess, like staffers or policymakers find stuff, but it's not as up to date. It's not necessarily as thorough as like JAMA or any sort of other academic journal. And so there's just science just isn't accessible, and it's not accessible for us and it's not accessible for policymakers. But another issue is that policymakers don't reach out to experts. I've asked several times after each call, because I get to do a survey, when have you reached out to a local professor? When have you reached out to a public health student? And every single time, all of them have said, I've never thought about doing that. And so that's an issue too, is that they also don't reach out to find, the evidence. And granted, they're busy and all of that, but they don't pursue that option. And then on the other hand, researchers just don't reach out either. They don't think it's their job. There is an issue in public health right now. It's a big discussion about where do you implement advocacy into public health? And is it our job to do that? Like, isn't science supposed to be impartial? That's what a lot of researchers will say. They'll say science is supposed to be impartial. We're not supposed to have a say whatsoever. But I obviously disagree with that. I think science is political. I think the decisions that science makes is political. And I think that politics has a huge impact on science. And so I think if anything, if there's anything you get from the end of my presentation, it's that you should try to be more involved if you can. I granted that it's like a very privileged take, but if you can get involved and you can reach out, try to do so, because we need more people like y'all reaching out to policymakers. Okay, so this is actually one of my favorite parts of this, because I learned this in my grad class literally last term. But there's this thing called the 3 streams of policymaking, and it's by this guy named John Kingdon. And so it's the problem stream, the policy stream, and the political stream. And these 3 streams work together to form policy. And I'm not going to go into the nitty-gritty details of like how to pass a bill. You guys can watch Schoolhouse Rock or whatever it's called to like understand that. And you guys don't really need to know that. But basically, these are the 3 factors that determine whether a policy is going to be formed. And I'm going to go into that in a little bit. So the problem stream is kind of obvious. So what are current issues plaguing society right now? So I know a big thing that everyone's talking about is COVID tests. Why are we only getting 4 COVID tests per household? And if you live in an apartment building, like you can't sign up because somebody else in your apartment building signed up. And so it's issues like that that policymakers think about, and they listen and they're like, okay, what can we do to solve this? And so that usually is a big thing that policymakers will listen to, and they'll be like, okay, let's see what we can do about it. Also the current climate. My favorite example of this is the Parkland kids, because after their school unfortunately got shot up, you know, they talked about it. They said this is not okay, and they found that a lot of people around the US were supportive of that. And so they brought themselves into the discussion, and they made it a big part of the political climate. And then the last part is political will. I'm going to emphasize this a lot, but political will is a big part of passing policy. And one thing that, you know, is mentioned is, can politicians at the state or federal level actually resolve these issues? Sometimes they can't. Sometimes it's through another organization. Sometimes it's through like OSHA or like the FDA. And so they can't really pass policy. But if they can, then they're going to try to resolve it, and they'll see what sort of legislation can get passed. Another thing that I also want to mention is that I've also seen a lot of researchers or public health students reach out to their US senator, and their US senator will say, this is not a federal issue, this is a state issue. And so I want y'all to remember that there is a lot of stuff that happens at the state level, especially in California, because y'all have a very fully professional legislature. So they're always working full time, and they're always passing laws. And so reach out to your state senator and your state rep, because a lot of the stuff that affects your daily lives happens at the local level. Local politics is important. So just think about that. Think about whether the political will is there, but also think about whether it needs to happen at the state or the federal level. The policy stream. Okay, so I also see this issue happen all the time. These researchers will have these amazing ideas for how to solve health disparities, but the issue is it's not feasible. Like, yes, I would absolutely love Medicare for all, but the thing is, how do you make that happen, right? It's the political will there. How do you make it happen, like economically, politically, and all of that? And so you have to really think about whether something is feasible, whether it's at the state or the federal level, because otherwise it's just not going to get passed. Another thing that I think public health schools really fail to emphasize for like policy schools is that they don't talk about the economics or the cost of things happening. Very few public health policy programs actually add like economics classes, microeconomic classes, finance classes into their program. So whenever researchers try to, you know, suggest a policy, usually the staffer will be like, okay, that's great, but how much is this going to cost me? That's always the bottom line. Is the money there to pass this policy, or is it not? And if it's not there, then it's just, unfortunately, it's just not going to get passed. Excuse me. And then the last one is evidence. Believe it or not, excuse me, believe it or not, evidence really does play a large role in policy. I promise you, these policymakers are not pulling these policy ideas out of their asses. Like they have done research, the staffers have done research. And so they actually do look for evidence and for research. The only issue is, does it fit with what they're looking for? Does it fit with the idea that they're going for? Does it fit with the legislation that they're going for? So don't be afraid to reach out to the Republican senator or the Dem senator because you think they're not going to support it because they don't support science. I promise you, it's just a facade. They absolutely do support the science. They're just trying to play to their base. And then the last stream is the politics stream. And I really want to focus on this one because politics really is the biggest influence in policy formation. So political will really does have a big influence. And so if you have what we have now, which is a deadlock Senate. So there's 50 Republican senators and there's 50 Dem senators, and our tying vote is Vice President Harris, right? But I'm sure y'all have all heard you need 60 votes to pass anything in the Senate, and we just don't have that. Like the Dems don't have that, and so they're deadlocked, and that's why they're talking about filibuster and all of that. But anyways, my point being is that you have to have the political will to pass these things, unless you do a reconciliation bill, but that's a whole other complicated process. You have to have the political will to pass these things. You can get it through the House, but if it's not going to pass through the Senate, then it's going to die, and your bill is done. You can try to sneak it into another bill, but it might be done. And you just have to take into the political climate as well. Like, for example, we're all going through a pandemic right now, right? Like it's been ongoing. Probably a good idea to try to pass something like hazard pay for nurses, maybe try to keep people from paying student loans. Like this is the perfect time to do it, right? And talk about these things because we are still in a pandemic. You probably don't want to try to pass something like enforcing people to go back to work. So that in itself proves that like political will is like really important, but also timing is important. So midterms are coming up, and I hate to say it, but Dems are probably going to lose the Senate and maybe even the House. And so depending on how Dems feel right now, they might be trying to pass things at the last minute because they know they're about to lose re-election. And so look for these windows of opportunity. Like Dems might be trying to pass stuff. If COVID or infrastructure week is like on topic right now, try to see if you can talk to your representative or your senator about passing something related to that, or like voting yes on something. Windows of opportunity come by very rarely. And so if you see one, take it, because it's just, you never know when it's going to come back. And then again, I do really want to emphasize that yes, I promise you from what I've seen, because I have to work with Republican and Democrat like reps and senators, they really do take into account the science and the evidence that is there. Because if they don't, then they're going to look stupid and they're going to have to explain it to their base or their constituents back home. And so don't be afraid to use science and evidence whenever you talk to them, because it will help them build their case for said legislation. Okay. So one thing I want to talk about, one thing I want to talk about is how to communicate to policymakers. And so I don't know if anyone, has seen Don't Look Up, but I want to show you this clip of Dr. Mindy, who's Leonardo DiCaprio, talking to President Meryl Streep about said issue. And so I hope y'all enjoyed this. Nope, sorry.
I heard there.
Okay, so you're probably wondering, why did I just show you that? Well, here's the thing. He did a terrible job of talking to President Meryl Streep. These are the things that he specifically did wrong. So first of all, he used way too much jargon. Like, what is orc cloud? I have no idea what that is. What do you mean 5 to 10 kilometers? Like, I can't visualize that. When you talk to your representative or your senator, do not use that much jargon. If I can't understand it, they're not going to understand it. And I'm a science major, so definitely don't use too much jargon. He also used way too much exposition. Like Jonah Hill's character literally said, just tell us what it is. Get to the point early, bottom line up front. Tell us what it is, tell us up front, and then give us supporting details, because otherwise you're going to lose my interest. And then another thing that I realize is very controversial among scientists, He used way too many numbers. Like, you just need one big statistic to prove your point, and that'll tell the story in and of itself. You do not need to use numbers. You do not need to provide all of this extra evidence. You being a public health student in and of itself provides credibility. You just need one statistic, and I promise you they will listen to you and believe you. If you use way too many numbers, it's going to get too complicated and they're going to lose it. So it's just also why I wanted to bring in this thing called social math, but I'll get to that in a little bit. Okay, so if I was in Dr. Mindy's shoes, again, I would get to the point immediately. I would say there is an asteroid coming to Earth that can cause basically worldwide extinction. No one will survive. I would say that immediately, just to set the tone of how drastic this is. I also wouldn't use jargon. I would say a large asteroid is coming to Earth and causing a worldwide extinction. Literally everyone will die. Them saying 100% and then politicians twisting it to 60 and 70% happens all the time. And they will say stuff like, don't use 100%, because they want to see how things play out. They want to see how they can protect themselves and how they're going to look to the media, but also to the public. So don't use jargon, don't over explain, because you're going to lose them. And yeah, just use one statistic, because you're going to lose them, but also basically they're going to try to twist your words around. So this is how I would do it. I would say my main point: there is an asteroid coming to Earth that will cause worldwide extinction and people will die. I would use the supporting details. So I would say Jennifer Lawrence's character, whatever her name is, found this asteroid. We discovered it using this telescope, but I also wouldn't over explain. I would say there is a very, very large chance of impact coming, or very large chance of impact. And then I would say make policy recommendations. I would say, what can we do about this? And I would say what I could say. The reason why I added this little asterisk is because if you work for a university as a researcher, you might want to talk to your counsel or your lawyers about whether you can lobby or not. Because if you make any sort of policy recommendation as a researcher, or even as a public health student, you could be considered lobbying, and your university might not support that. So before you make any sort of policy recommendations, I would talk to a lawyer, talk to the council at your school, especially if you're doing it on behalf of said school. So if I was to lead a lobby day on behalf of my organization, I can do that because I'm protected, but I can't do it on behalf of Hopkins because there are laws that protect it, and because Hopkins gets a lot of grant funding, and so they can't lose that funding because I decide to lobby. Okay, so the reason why I also brought up social math is because this is one way to use statistics in a very interesting and compelling way. So my favorite example is actually the ACLU campaign in Nevada. And basically they said Nevadans spend $8,223 per student for schools, but they spend about $130,101 per youth in jails. So would you rather invest in youth in schools, or would you rather invest in schools or youth in jailhouses? And so they brought that in a very compelling way. Another thing that I also brought up, because Dr. Minnie was like, a 5 to 10 kilometer wide asteroid is coming to hit Earth. No one knows what that looks like unless you're really into science. And so use the numbers in a way that people can visualize. So instead of saying the average American child drinks 5,400 ounces of soda yearly, say the average American child drinks a bathtub's worth of soda every year. They can't visualize 5,400 ounces, but they can visualize a bathtub's worth of soda. So try to use numbers in a way that people can visualize, or like in numbers that they can actually get their attention, because otherwise the numbers are just going to go over their head. There are a lot of resources on social math out there, but it also takes a lot of practice to get to do that. But we can also talk about that later on. I also really love this graphic. It was also done by the ACLU in Nevada, and they basically showed just how many guns are out there. So this is another way of using numbers in a really compelling way, is they actually showed just how many gun dealers there are versus high schools versus libraries, and then McDonald's restaurants. And so this really shows just how prevalent guns are in Nevada. Actually, this is California. I'm sorry. This is how prevalent guns are in California. And so they really made like a really good visual out of it. rather than just using numbers of like, oh, there's 11,000 gun dealers here in California. They actually made a really good visual. And so this is another really good example of using social math as well. Okay, so another thing I want to talk about is getting involved. And I know a lot of y'all already do that, but I just think that we can do more if you can. Like if you have the time to do it, try to join interest groups because everything's always better in numbers. Like grassroots groups are really important. And I can assure you that at the federal level, people are mostly listening to grassroots or interest groups, basically. And then obviously lobbying, but there's just more strength in numbers because they understand that these are votes that might be losing. And also interest groups and community groups are just well staffed. They know what they're doing. They know how to lobby, and they know how to basically reach out to your representative to get them to vote yes or no on something. I know this is kind of a big thing back in 2018, but you can still contact your rep or your senator at the federal level, but also at the state level. They have to listen to you. It's their job, unless they unplug the phone, but they do have to listen to you. It is their job, and they can't ignore you. They are going to take down your notes and say basically what you said, and they might present it to your representative or your senator. But also don't call other states, like don't call someone in Texas and complain to like Ted Cruz's office. I promise you they're not going to listen to you and they're not going to give you the time of day because you're not a constituent. So only call your representative or your senator, but also be nice. Like they're our age, they're staffers, they listen to a lot of stuff. They unfortunately listen to a lot of abuse too. And so just be nice when you contact them, be stern, be firm, and use the same talking points that I said. So get to the main point, add supporting details, and then tell them what you think they should do. Another thing that's also really important that I think researchers and public health students don't really talk about is that you should publish your work. You should talk about what it is that you're studying and the things that you've learned, especially outside of an academic circle, because articles just aren't accessible to anyone outside of academia. So write an op-ed, write a letter to your editor, write a letter to your senator or your representative, write an email, write a policy brief that you worked on in class to your senator or your representative. These are all ways of getting their attention and getting them to listen. Because I promise you, if they really like what you wrote, they will reach back out and they will talk to you and set up a time to talk to you. So just try to publish your stuff outside of work. Outside of academia. I will even bring up this one example. I had to write a policy brief on road transportation in Virginia, and I have no idea of like what road transportation should look like in the DMV. Like I just moved here, but I found this really cool policy brief written by UNC researchers that was on their center's website. So it was outside of academia, and I was able to find that because they published it outside of an article or outside of a journal. And so it's stuff like that. When you publish it out there, someone like me will find it, and I will write an entire policy brief to give to my boss based off of that. So if you think no one's listening, I promise you there is somebody out there who's listening and reading these things, especially if it's good and compelling. Sorry. And then of course, there are all these amazing organizations that you can join and you can support and be a part of their grassroots fund. And so when they send you and they're like, especially with Michelle Go, who unfortunately was killed in New York City, they're going to send you guys out alerts and say, hey, look, this is happening. We're going to try to make this push at the federal level to say we need to actually do something more about Asian hate crimes. And so when you think that you're not going to make a difference, if 50 people said that, it's like not true. So like the more that you do these things, the more that you put pressure on your representatives and your senators, the stronger these things will be. So I highly recommend you join these organizations. If anything, sign up for their like advocacy or political alerts. That way you can just send a quick text, or you can just send some sort of support or like email on behalf of this organization to your representative or your senator. And I mean, I'm going to share these slides later. So if you don't want to, if you want to like see these for later, like I'll share my slides with y'all. But I basically want to end my presentation with this. There is only one congressional member of Pilipinx descent in Congress right now. Did y'all know that? Like we make up a sizable amount of the US and there's only one of us in Congress? Like that's not okay. I'm not saying that y'all should run for office. I mean, if you want to run for office, like please, we need more of us in Congress. But we need more of us doing the work in Congress. We need more people reaching out in any way that that looks like for you. It can be as simple as reaching out to your senator. It can be as simple as writing an op-ed. We just need more representation, and we need more people like us speaking out and saying something, especially to our congressional members who don't necessarily represent us and don't understand our background, our story, or our needs either. And so it's kind of our job also to tell them how to represent us and how to better serve us as well. And if you're scared about jumping into politics, look at my background. I started with a biology degree. I had no idea politics. My parents were very upset with me when I told them I wanted to work on a congressional campaign. They're like, why can't you become a nurse like your cousin? Or why can't you be a doctor like you always planned? And it took a lot of me fighting them and getting them to understand that, no, we need more people like me, more people like y'all out there fighting and saying something and telling them like, this is not right, or we need to do more about this. And so please reach out. Please talk to the staffers at the state or federal level and tell them what they can do better, and try to push the limit and try to tell them what kind of legislation they need to pass. And be honest, like, you guys have so much knowledge. Y'all are all public health students. Y'all are all really smart. So tell them, be honest with them, and use the tips and tools that I taught y'all today to reach out and talk to them, so that way they understand how to serve you and you know how to communicate to them. And with that, I conclude my presentation. So if y'all have any questions, I'm here.
I'm going to go ahead and remove your spotlight just so we can see everybody. Feel free, if you have a question, to either raise your hand or go ahead and speak it out. Okay. Yeah, Jarrell.
Hi, I just had a question. So if you are, because I'm kind of interested now about like the graduate programs.
Yeah.
What graduate programs do you recommend students like me go into if we were to go into health policy? And in addition to that, what internships do you recommend, or what organizations do you think people can go into if they're interested in going into health policy?
Okay, yeah. Okay, so I'm going to tackle each question at a time. So I'm really big on learning economics and policy. That is the biggest, I would say, one of the biggest factors. So look for any sort of program that also adds like macro or microeconomics into their curriculum. And if it's not in their curriculum, ask them about whether you can take classes outside of your curriculum to supplement your curriculum. So the schools that I applied to were obviously Hopkins, because they have applied microeconomics, but I'm also taking a health economics track right now. I also applied to mostly public policy schools. So Berkeley has a fantastic public policy program. I forgot what it's called. I'm sorry. Minnesota also has one. LBJ in Texas also has one. What else? I mostly applied to public policy programs because I really wanted the economics background, but I also wanted to understand political will and political analysis and all of that. And so I took more of like a government affairs policy route. But if you want to take more of like translating research into science, then I would go for a traditional health policy program. So you could apply somewhere like Hopkins and get both, or you can apply somewhere like UNC, Berkeley, I'm trying to think of more, GWU. I also will say, I'm going to be completely blunt with you. I would not apply to anything that isn't in like the top 20 public health schools, because unfortunately name does matter. And if you're not in like a top 20 public health school, like you might have a harder time finding a job because this field is very saturated. And then, sorry, you asked about internships, right? Yeah. Okay. I will say, so the organization that I work for also has internships available. Unfortunately, they're unpaid, so I understand if that's not something that you want to pursue, but there are so many internships out there. I know the CDC is always looking for people, the FDA. I definitely would start with government agencies if you can. But even like local and community groups. Like I'm doing an internship right now where I'm helping this one organization in Dallas do better vaccine outreach. And so I'm literally translating the research that I've learned, or I'm like reading it at Hopkins, into community focused language. So how do you get people who have, don't really trust the vaccine to go get vaccinated? And so I'm working on that side of translating research into community focused language. I think it's really also depending on what sort of focus you want to take, because there's so many things you can take with policy. If you want to do the political route and do political analysis or like government affairs, then definitely look more into stuff like that. Look into more like economic stuff, more like public policy schools. But if you want to do translating research into policy, then you can do that at almost any public health school. Does that answer your question?
Yeah, it does. Thank you so much.
Of course. Also, I'm gonna drop my email in the chat. So like if anyone wants to reach out and like ask me more questions or do like an informational interview, I'm also very happy to do that as well after this.
Someone asked, who's the Pilipinx congressional member?
Bobby Scott in Virginia. Also, I'm a political nerd, so of course I knew that off the top of my head, but yes, he's in Virginia right now.
Oh, I have a question.
Sure, what's your question?
Awesome. So hi, I just graduated from my undergrad like a couple of months ago. So for me, finding an entry-level job in like health policy seems really difficult. So what is like an entry-level job for those interested in health policy?
So this also depends on you as well. So I knew I couldn't afford a staffer job in DC. That obviously was my top choice, but I can't afford to make $33K and live in DC because our rent prices are too high. And that's also something that I've been coming to terms with as well. So if you can afford to be a staffer here, I highly recommend it. Or even like a staffer, if I'm assuming you're in California. Yeah, I would apply to work in your state legislature. Like your state legislature is amazing. They're fully professional. They work full time. I don't know the salaries, but I'm sure they pay decently, especially because you're already there, and they're more likely to hire you because you are a California native. So I would start there if you want to do any sort of like passing policy or just understanding like the policy formation process. You can also look into positions like program coordinator. So that was my first job out of my first big girl job out of college. I guess if you count like the congressional campaign, but I worked for the American Heart Association as a program coordinator, and they're always hiring for entry-level roles. So you can look for like a program coordinator position, program analyst, analyst position, just sort of look for that type of title and just look how much they're paying, and that can tell you whether it's entry-level or mid-level. But I would start there as well at nonprofit.
Awesome. And what was the organization name again?
The American Heart Association.
Oh, okay, cool.
Yeah, so
Awesome.
look at like national nonprofits. The American Lung Association is also great. I think they hire a lot in California too. You can even look at advocacy groups. I'm pretty sure hiring for like political coordinator positions as well. But look for any sort of like coordinator or analyst position and just start there.
All right, thank you so much. And I'm saving all the links everyone's putting in the chat. So thank you all for the chat.
Yes, Momo. Oh, sorry. Momo raised her hand, and then we'll go to Jason.
This is gonna sound like a funny question, but I'm being so honest right now.
No,
How do you? Okay, sweet. How do you do all the work to try to push to policy and it doesn't happen? And how do you not cry? Like, to me, it's just like it's a whole world that I just don't understand. So that's why I'm like, how do you just not?
No, I hear you. I hear you.
Yeah.
Okay, how do I answer this? So, okay, I'm gonna start off with a funny story and then I'll get kind of serious. Is that fair? Okay, so back when I still worked at the American Heart Association, there was talks about expanding Medicaid in Texas. And like, let's be honest here, okay? Texas is a red state and they're the ones that are suing. They're the ones that are suing to basically remove the Affordable Care Act. So it was never going to happen. And I don't know why they thought it was going to happen, but one of their government relations managers was like, it's going to happen. We have the votes, like, let's go. Like, we're just going to watch it. And the whole time I was like, sir, you must be new here because it's not going to happen. It's just not. And like, everyone was talking about it. And I was like, it's not going to happen. And like, even my friends who are here watching, like they can vouch, like it was never going to happen. But of course, it didn't happen. And so it's stuff like that that I'm like, you have to be realistic and just know it's not going to happen. They're going to tell you to their face they're going to vote for it, but then the boss is going to make a like last minute change and say, you know what, I'm not going to do it. So stuff like that happens all the time, and for stuff that you wouldn't even expect, but it happens all the time. And then there are times where like you really thought you were going to get a win and you had the votes, and then you see at the last minute that someone voted no, and you had been working on this campaign for so long that you've lost sleep over it. You've thought about it all the time, like it's just in the back burner of your mind, and then you lose. And you're like, I want to cry. I don't want to get drunk and, you know, drink my feelings away, but sometimes that happens. And this is kind of, I think, somewhat personal, but because of COVID, I've been sort of thinking about what I want my life to look like in the next 5 years, and, you know, how much emphasis I want to put on work and how much emphasis I want to put on work-life balance as well. And I'm kind of getting to a point where it's like, my work doesn't define me anymore. My work is not who I am at my core. I know, no, I'm telling you, like, I've had this realization, like, look, things are changing for me. Like 2020 is my year, okay? Anyways, I'm just coming to this realization that like work does not define me. It doesn't define me. There's so many other things that are important about me, like my relationships with my friends, my families, love relationships, you know, school, who I am as a person, like the interests that I cultivate outside of work and outside of my friends. Those are the things that define me. And I hope also that y'all don't see work and whether you get these policy wins as like a reflection of who you are, because it's not. These are a lot of outside influences. And so I think one thing to help you realize is that it's baby steps. One, like we're never going to get there all at once. I would love to pass Medicare for all before I die. I don't know if it's going to happen, but you know what? Maybe it will. But the thing is, I know it's not going to happen overnight. It's baby steps. It's adding little things every day or every time that there's someone new in the office and just trying from there. But also define yourself outside of work, define yourself outside of other people, and like figure out who it is that you are at your core, because at the end of the day, that is a reflection of who you are and not your policy wins. And that's for everyone in this chat who's a policy nerd and in politics. Like, do not define yourself off that, because I know we do that all the time. Don't do it. We are much more than that, I promise. I think Jason had a question. So hi,
yeah.
nice to finally meet you. Like, I know we're like mutuals on Twitter, so
I
it's
know.
really nice to finally meet you.
The funny part of this conference is most people I know on Twitter, but I know the flip side of like policy is that, or when we're doing like our scientific researcher background, is that, you know, sometimes people can take our data and flip it against us. That's always been, I think, always the challenge. Like, for example, I mean, well, I don't like using COVID all the time, but I mean, it's the most relevant in my head. But like taking, when you have like showing disparities or inequities, and then people flipping it and saying, oh, look, I'm not affected, and X, Y, and Z. So I wonder how do you approach those types of situations when it's clear there's inequities here, but there's always that challenge of like making sure that message gets across.
Right. So I'll tackle the first part of your question, which is like people switch our stuff up all the time, right? So thankfully, like when I worked at the American Heart Association, we had a very strong media team. And so if anyone tried to sort of flip what we said, there was an immediate response of like a press release saying that it's not at all what we said, it's been misconstrued. These are not following our values. And so one way to do that is to get ahead and say, that's not true, that's not what we said. So start off there. As for disparities, I hear you. I think that is a continuous conversation that we have to have, especially with representatives and senators who don't understand us and who don't represent us and don't look like us and don't understand us. I think it's a continual process, unfortunately, of getting them to understand us. I will say one thing that you can do to like really get their point across is statistics. Like use one really good statistic. I think the one statistic about, I think it was 2.64 nurses, like Filipinx nurses died of COVID despite only making up 4% of the population. That is a huge statistic. And that, I mean, that went viral all on its own. Like if your statistic is strong enough, it will speak for itself. So find that hook and like really use that to emphasize, hey, there are disparities here, and use numbers in that way. And use social math, because that is really what's going to get people across. Because when you talk to staffers, what they're going to remember are these big hooks and these big statistics, and that's what they're going to take back to their boss. So just make sure you have your overall message, and get that across when you talk to staffers, and use statistics sparingly, but use really good ones. Does that help?
Yes, thanks.
Anybody else? Like, I'm ready. I'm amped up, y'all.
I think we have time for 1 or 2 questions, and then we will end with a group photo. And then we will go into our break before our guest panel.
If no one else has a question, I have another question. So, what does the team actually, like, what is the team actually composed of when it comes to, like, policy making? Like, I know there's researchers, I know there's staffers, but like the whole gambit of it, what does it look like?
Are you talking about like in like a Senate or representative's office? Or are you talking like from an organization's perspective, or both?
Mostly organization, because that's more tangible to me, but yeah.
Okay, yeah, I got you. So okay, I'm gonna do it from like a small organization start, and then I'm gonna go to the big one. So like I work for a really small organization right now, and so I am one of 3 policy associates. And so what'll happen is, so I actually recently worked on a policy brief for Representative Ed Case, who's in Hawaii, and he was asking about this one issue. And so I met with him and another one of my interns, and we basically asked like what it is that his office needs information on. So we got that information. The intern took really great notes for me. And then I reached out to researchers in our network and said, hey, this office is looking for this. Does anybody have information on this? And so a couple of researchers reached out. My intern basically put together stuff for me, and then I sent it to my boss, who is the supervising policy manager. And then on top of her is our PI, because it's also science-based, this organization. So we also have a PI who basically does research as well. And there's 3 other PIs in our team. And then we also have a government relations director. We also have an overall director of the organization, and then that's it. So there's a lot of, it's very bottom heavy in my organization. At a nonprofit, like a national nonprofit, like at AHA, it's very top heavy. And so there's a lot of policy managers, policy directors, advocacy directors, advocacy vice presidents, federal vice president, community vice president. Like they tackle all sides of the coin. So there's like a federal, a state, community, get to the bottom ones like me, who do like program coordinating, policy associate, policy coordinator, policy manager. We also have a media team. So there's media advocacy. There's translational research. So there's a couple like science and medicine advisors who will do the translational research into like media advocacy. Yeah, they're just, AHA is very well funded. So like they have a lot of staff to tackle all sides of, you know, a campaign. Yes, I think you have your hand up, unless there's something else.
I just have another question again.
Yeah.
So what is like your biggest accomplishment working in health policy then so far?
Oh, I like this question. Okay, so back in April 2020, so I'm from Dallas, and I saw that there just wasn't enough testing sites in my neighborhood or even in my community. And I saw it. And I know Dallas doesn't really have public transportation, but there are a lot of people who also don't have cars. And so I knew immediately that there were going to be testing disparities. And so actually, in fact, give me 1 second. I'm going to share this with y'all as well. So I knew immediately that there just wasn't enough COVID testing sites in my neighborhood. And in fact, I wrote about it. I wrote to the Dallas Morning News, and I said, there is a huge disparity between there's a huge disparity between COVID testing sites in the north, which is where mostly like white neighborhoods are, white wealthy neighborhoods are, versus where I live. I live in a predominantly like Black and Hispanic neighborhood, and there aren't enough testing sites. And in fact, here, I'm going to put my op-ed in the chat. But I basically said that for every 2 sites up north, there's only 1 site down south. And that was my hook. There is a huge disparity. And there are way more people down south. So I think it was like for every 2.3 testing sites per 100,000 people up north, there's only 1.1 testing site per 100,000 people down south. And that's a huge disparity. And that was my hook right then and there. I only used 1 statistic, and that was all I needed. And immediately after that, the Dallas County judge was like, all right, we got to expand our testing sites. And NPR wrote about it. And so we now have so many testing sites. There's mobile testing sites. They like started doing like flu vaccine shots at Walmart near me, or like back in my hometown. But all it took was that 1 op-ed, and they're like, you know what? She's right. There's a huge testing disparity, and they spread out their testing sites because of it. So if you don't think you have an impact, you do. Write and publish and speak up, and I promise you somebody is listening. And I did this all before being a grad student at Hopkins. So I'm just saying, y'all have the knowledge, y'all can do it, y'all can write, y'all can speak well. If you can, do it, write something about it and speak up, because I promise you somebody is listening. But yeah, write to your local paper, write to your politician. They're listening, I promise. And these things will make a difference, especially at the local level. Like local politics is very important, y'all. So definitely also start there, and don't forget that. Oh, also, I'm sorry. Let me put, yes, local level. Let me put my email in the chat. So if anyone has any questions, please do not hesitate to reach out. School is starting for me on Monday, but I promise I will get back to y'all. I'm pretty good with my email. Yes, public health is always local. So please reach out if y'all have any questions. I promise I will reach out and get back to y'all. We can do a Zoom meeting. We can, if you're in the DMV area, we can meet up. And yeah, feel free to ask me questions. I'm more than happy to help and like do for y'all what someone did for me. So
Thank you for that. We are a little over time, 5 minutes, but we'll take that last question from the raised hand. But first, someone asked in the chat, if you haven't answered already, do you have any good book recommendations, podcasts to talk about policy and health policy?
I do. Okay, so from the political side, I'm sorry, I'm such a nerd, y'all. Okay, like if that hasn't been obvious, I do have a LinkedIn. I will get to that as well. So my first book recommendation would be if you are really interested in seeing how if you're really interested to see how politics happens at the local level, there's this great book called All Politics is Local by Megan Winter. Let me see if I can find it. I'll put the book in the chat as well. Yeah, it's All Politics is Local by I'm sorry, I'm gonna have to use, actually, here's the Goodreads link. I was like, I don't want to use an Amazon link. But here is the first book, All Politics is Local and Why Progressives Must Fight for the State. I highly recommend this book to understanding just how important local politics are. If you're interested in health insurance and why everything is so messed up, I highly recommend this one book called Healthcare is Big Business. Give me 1 second. It was a New York Times bestseller a long time ago, like in 2016. Find it. Okay, sorry, it's called An American Sickness, and it's how healthcare became big business. And it's basically from the perspective of a former, I think she's a former ER doctor, and she's talking about basically how messed up the US healthcare system is, and just also how much it hasn't changed since 2016. Granted, the Affordable Care Act has helped a lot with some of these other things, but you know, it's still a mess. And so I recommend that if you want to better understand how messed up our healthcare system is. For podcasts, give me a second. See. And then I also promise I'll get to my LinkedIn. Okay, so I used to listen to Left, Right, and Center, but not a fan of it anymore. Let's see. Oh, you know what? I'm gonna recommend a fun one. I do recommend Conan Needs a Friend. It's my favorite one right now. And like sometimes I just need a break because life is very stressful, but Conan Needs a Friend is great. Hold on, let me actually find a serious podcast. Give me 1 second. I do listen to the news a lot, so I do. Oh, okay, I'm sorry. I do have one. Okay. Public Health on Call is, I'm sorry. I swear I'm like a lot more coherent. My thoughts are together. My really good friend, her name is Elisa Zhu. She is a reporter. She's one of the reporters for this podcast called Public Health on Call, which is with Hopkins. And yeah, no, she's great. I'm going to shout out her podcast because she is one of the reporters on there. And so she actually recently did a podcast episode for abortion in Mississippi or Missouri. And all of that reporting was her. Yes, it is on Spotify, but it's Public Health on Call. And yeah, it's through Hopkins. So that, yes, it is good. But yeah, that's my friend Elisa. I'm going to shout her out because she's amazing. And that was all her. And then let me send y'all my LinkedIn. Was there anything else? I think it was books and podcasts. Was there anything else that y'all asked about public health recommendations that I forgot?
No, that was it.
Okay, let me send my LinkedIn in the chat. Please connect with me. Y'all want to reach out to me there as well. Happy to do that as well. If you guys want to talk more about careers in this field and like what to look for, but also if y'all want to hear my potential career trajectory moving forward, we can also talk about that, because when I first moved here to the DMV, I thought I was going to be a staffer on the Hill, and I'm starting to see that that is not the case anymore. Yeah, which I'm actually really happy about. And my friends on the chat are probably gonna be like, what? Like when did this happen? But yeah, so it's yeah. Work-life balance is really important. Don't lose yourself in the job or in the goals of the careers. Like, if anything, like please, like you are something outside of politics and your job and your role as a student, but also speak up. You are being heard and you're important, and you guys are so smart and you guys have a lot to add. And you know, someone is listening and someone will make a difference because of something that you said. So if you ever think like no one is listening, I promise you somebody is, and chances are it's going to be me, because I'm going to write a policy brief about something that you wrote. So as long as it's out there on the internet, I will find it, I promise. And yeah, please reach out if anyone has any questions. And of course, stay safe, y'all. Omicron is not a joke. So please stay safe, upgrade your masks, get tested regularly with STDs and with COVID. And it was great talking to y'all. Thank you for not making me feel really nervous, because I was really nervous about this morning. So please reach out and have a great rest of your morning.
Yes, and that concludes our first workshop. We are 10 minutes over schedule, but that is okay. Again, Kat, thank you for your insight and your information on public health policy. I would like to take a photo if everyone wants to turn on their cameras. I'll stop recording now.